Hi, I'm Dr. Hassan from Care Chiropractic. Today we're going to talk about the importance of the hormone and the hormone replacement therapy. And my lovely assistant Becky is going to ask me some questions, and I'm trying to answer as much possible. Okay, Becky.
Okay. What is hormone replacement therapy?
As the name suggests, replacement means when it needs to be replaced. When the when the level of the hormone goes down, and every ages is different. For men usually between 30 and 40, for women after 50 for sure, the hormone goes down. And hormone controls our life in various ways. It controls our mood, our strength, our energy, depression, sleeping, as a whole, the whole well-being. So if it goes down, you do not feel good. It's not probably a life-threatening, but obviously you do not have the quality of life. That's why it's important to make the hormone in the optimum level.
Okay. What are the benefits of hormone therapy?
Well, there's a multiple benefits. As I mentioned before, the hormone really controls our life. So for male and female, we are having like two different set. For male, it gives the energy, it gives the sex drive, increase your more muscle, less fat. It gives you the ability to think clearly. The brain fog will be over. It also increases your like lean body mass, and as I mentioned before, the sex drive. So all of this benefit you get from the testosterone. For the women need both testosterone and estrogen. Most of the women think they need estrogen, which is a wrong idea. They need a little bit of testosterone. Testosterone does only two things for the women, but these are important. It increases their sex drive, increases their energy. On the other side, the estrogen does it helps them to get over with the hot flash. It improves their skin and as a whole appearance. It also improves their like depression. It also stabilizes their mood. Estrogen is also very important for the bone. As you know that all the women has osteoporosis after 50s when they cease their cycle, but it is very important they keep their estrogen and testosterone level optimum.
And what/who are pellets for?
Well, again, it's tough to say. First of all, you have to have the symptoms. You have to feel tired, exhausted, fatigue, lack of sex drive. In case of women, you might have hot flash, mood swing, for difficulty to concentrate. So those are the symptoms you have. Then you come to us. We have to do some blood work first. We cannot just put a hormone to you. We have to do the blood work. We have to have the level of the hormone. Then we can decide who is the candidate and how much hormone we introduce to them.
Are the pellets different for men than women?
Yes, men gets only testosterone pellet, women gets both estrogen and testosterone pellet, and we also recommend for the women to take progesterone as an oral pill. Progesterone is kind of like a safeguard from anything bad from the estrogen. It also improves your quality of sleep. We do not give progesterone in the forms of the pellet because these are pretty big pellet, but we rather give them in the form of the tablet, oral tablet.
And what does hormone pellets do?
Well, hormone pellets do the same thing. Since it's a hormone pellet, if you are low in the testosterone, we put the testosterone pellet in you if it's a man, and it slowly raises your level, and the level remains the high and consistently high for about 4 to 5 months, and then you need to be repellet again. In the women, we put the estrogen and testosterone. It does the same thing. If you are those hormones are low, it will make you feel better. Your mood goes up. Your sex drive comes back. You feel energetic. You do not have any more hot flash. All of those things which you are not which you are having because of the low hormone.
And how and where are pellets inserted?
It's a very simple procedure. You have to come to us and just make sure you do not take any kind of blood thinner like an aspirin, like ibuprofen, naproxen. We inserted it just above your above your waistline, just below the waistline, above the line of the pocket, of the back pocket, just between the line, between the waistline and just above your back pocket. That area is the ideal for pellet. And we started with a very small incision. It's about less than about 0.5 centimeter, very small, so small that it doesn't need any suture. We put some steady strips, and that is causing it to be enough to make it a nice closer.
Do you feel it?
You don't feel it. You don't feel it anything. We numb it very well. We numb it with the lidocaine and the spray. We make sure that we have to be 100% sure before I insert anything that you are 100% numb. You don't feel anything, but there are some post-procedural things you have to be followed. You cannot do any kind of squatting, heavy lifting, any kind of like leg press, this kind of exercise for 7 days. You cannot do any kind of swimming, hot tubbing for 3 to 4 days. That's pretty much it. There's nothing else.
And how long will it take for the pellets to get into your system?
Very good question. So usually it works slowly. So what happens, the day we insert the pellets, you don't feel the difference the following day. It takes 7 to 14 days. It varies from the person, not before 7, not after 14. So it slowly goes up. Once it goes up, it remains like this for 3 to 4 months. Then you start a dip. We inserted another pellet before you feel the dip. So you don't feel the dip, you just feel consistently very well.
And how long do the pellets last?
Well, that's a very good question. It usually varies in the person to person. Usually in the male, about 4 to 5 months. So male needs about 3 times a year. For women, it's about 3 months. So women needs about 4 times a year. But that is not written in the stone. If somebody is a very active person, usually because of the high metabolism, it can even go down faster. So what I say, the first time when somebody do the pellet, we can check it at the level of the 5 months for men, it was 4 months for men and 3 months for the women. And then we kind of get used to how soon or how late they want. Again, I saw women from 3 months to 4 months, or even 2.5 months, male from 5 months to 6 months, even at the 4 months. So everybody is different. After inserted 1 or 2 times, we know exactly how long it's going to last.
Wonderful. That's all the questions I have.
Thanks, Becky.
Thank you.
Asking question.